Today we're going to talk about potty training your child with Down syndrome from the first little tinkle in the potty chair all the way to underwear. The first thing I want to talk about is some different terminologies that you hear thrown out there, mostly around potty training children with special needs. Parent trained. We are not going to parent train you. You are going to give your child the supports that they need to be able to build the skills for toileting. We are going to think about this as if when your child was learning to walk and you gave them your little fingers and they were learning to balance, they were engaging all their stabilizing muscles to correct when they stepped over just a tiny little rug or something. That was the support that they needed to build those skills to be able to walk on their own. That is what you will be doing when you use our potty training method, Underwear for Kindergarten. You will be helping your child build the skills needed for toileting. Time trained. That is really truly when there is a timer set, the timer goes off and the child goes in to go potty. This can work, but it is not ideal because it does not help your child to build the pelvic floor muscles needed to truly be potty trained. So we want to be very careful about not using a timer for a long period of time in your child's potty training journey. It's okay to use a timer at the beginning so that you and your child are getting used to going into the bathroom and trying, but this is only until you start to find your child's natural patterns for pottying. Schedule trained. This, I believe, is the most effective way to gain independence for your children. When we schedule train a child, we are using your child's natural potty times and natural transitions in their day versus a timer that says, oh, you've gone 45 minutes, let's go in and go again. And then it's potty trained and they have built the brain-body connection to know when they need to go. They've built the skills to be independent and they're able to tell someone that they need to go potty. Let's start off talking about when to use a timer and how we should use that and how that should look for our children with Down syndrome. So it is okay in the beginning to set a timer or have your child have a potty watch and go every 20 minutes, every 30 minutes, every 45 minutes while you're trying to figure out your child's natural patterns. That is okay for about 3 months. After 3 months, we really want to have a better idea of when they're going to need to go and take them during those times rather than just every 20, 30, 45 minutes. If your child is able to go every time you take them in, that's great. You've really helped them to develop the brain-body connection of knowing how to relax the muscles that need to be relaxed and tighten the muscles that need to be tightened to go potty on the potty chair. However, if we continue on the course of using a timer, we are not engaging the pelvic floor muscles and we're not building the pelvic floor muscle, which is so crucial for true potty training. So we want to make sure that we continue to ask them to go more and start expanding the time between potty breaks. So if they're at 45 minutes, push it out another 10 minutes, another 15 minutes, another 20 minutes. They may have small accidents in their diaper. That is okay. During this time, we're going to make sure that we are continuing to ask the child to go more. Now, I've had a lot of questions about, well, how do you teach a child to go more? When you hear their little tinkle in the potty chair, you just say, oh, good going potty, go more, go more. And you may have to sit a while. Sometimes it takes about a 2 to 3 minute break in between potties for them to be able to initiate and go again, and you're going to praise them for going more. You should visibly be able to see more potty in the potty chair. It sounds crazy, but they do eventually start to understand what you're asking. So even a 2-year-old will start to go more. if you just continue to ask them and patiently wait. Schedule trained. My preference for developing independence in the bathroom by the time they're 5. First thing you need to do to be effective at schedule training your child is to get to know their body. Many things affect when your child may need to go potty. The amount of food they've ate, the kind of food they've ate, the amount of liquid they've drank, the amount of fluid they've lost through perspiration or breath. So the level of activity that they're involved in can change the time that they will need to go potty next. Again, this is a good reason to move away from a time-trained timer. Constipation. Constipation can cause your child to have urinary incontinence. So if your child's going through a time of constipation, they may need to go more frequently, and that's okay. And remember, not every potty has to end up in the potty chair. That's okay. Work your best to get the constipation under control and give them the opportunities to go potty on a time frame that would have been appropriate prior to the constipation issues. Certain medications can cause your child's potty schedule to change. So if your child is taking a new medication and their schedule is getting off, that could be why, and you'll need to make adjustments at that time. Another piece of schedule training is to start to use your child's natural transitions of their day. You're really going to want to focus on this when your child is able to go potty on the potty chair, when you take them and they're starting to go within 10 to 20 minutes of setting down or quicker. And during this time, you're also going to want to start to incorporate more potty breaks for them throughout their day. Some good times to try to take your child is when they first wake up in the morning, before or after morning snack, before or after lunch, before or after afternoon snack, before bed, before a nap, before any activity that you start or stop, before going outside, when you came in from being outside. You're going to start to use these transitions and say, oh, we're going to go outside, but we need to go potty first. You want to make sure that you are lining these transitions up the best you can with the amount of time that they need for pottying. So if your child's at the 1.5 or 2 hour potty break time, you're going to try to schedule, kind of have a transition like, oh, but we're going to go outside, but you need to go potty first when you know that it's time for that potty break. But you are not going to take them at every transition just because it's a transition. You're going to be mindful of the amount of time that your child can stay dry and take them during those transitions at the right times. Putting it all together, there's a lot of pieces, and it is not master one, then start another, master one, start another. We're going to kind of work on most all of this all simultaneously, and they're going to get fractionally better at all the skills until they're very good at them all and potty trained. So the first thing that we do when we're putting it all together is keep it positive. That's so, so important. You cannot potty train your child without their buy-in. If they decide that they don't want to do this any longer, then there's very little you can do about it. We want to make sure that we are keeping it positive, that they are feeling very little frustration from us or very little pressure from us. So when we put pressure on ourselves, like, okay, we really need to get potty trained, we're going to kindergarten in 2 months, and I just want this so bad for you, that pressure can cause the child to kind of stop progressing in the potty training process. It can cause regression, and it can cause them just to totally shut down. So a child who is going potty frequently on the potty chair for you may just all of a sudden start holding it and not going at all until you put the diaper on them. They're communicating to us, and they're really saying, I don't want to do this anymore. So we have to make sure that we're keeping it positive the whole time. The brain-body connection. Your child needs time to build the brain-body connection, and you can help them by pointing out when they're wet or dry through the whole potty training process. So every time that your child is dry, you say, "Oh, good, you're dry. Way to go. Good job being dry." And when they're wet, you say, "Oh, you're wet. Your diaper's wet." But we're going to make being dry a little bit more exciting so that they know that you like it when they're dry, and that's kind of a cool thing. Build toileting skills. We're going to start taking toileting needs to the bathroom so that your child is used to stopping their day, going into the bathroom, and taking care of those needs in there, so that as they get older, they don't become frustrated with needing to go into the bathroom when they haven't needed to stop those activities for 4 or 5 years prior to getting serious about potty training. Encourage your child to go more. Through the whole process, we're going to encourage your child to go more until they are really able to sit down and fully eliminate their bladder. And you're going to know that they're more fully eliminating their bladder by the amount of potty that's in the potty chair. And again, we just continue to ask them to go more until they understand what we're asking for. And every child really does understand this at some point. It can take a few months before they really get what you're asking of them, but once they do, they will go more for you. Keep on going. So many of our kids have these very weak streams, or even just kind of a dribble. We need to ask them to go more, and then we need to ask them to keep going. So when we ask for them to keep going, we're really asking them to continue their stream, to strengthen their stream, and continue the duration or increase the duration of their stream. This helps tremendously with the amount of time that it takes for them to go potty on the potty chair. This also helps with them fully eliminating their bladder once they have control over their stream. Staying dry. Work to increase the amount of time between potties. We need to increase that to 2 to 4 hours for our children who are 3 to 4 years old. Once your child can stay dry for 2 hours or 4 hours, then they can start practicing underwear. I will introduce practicing underwear in a separate video.